awake for all night sometimes if we have a toothache. And I wish that when you're watching our episode, our viewer that sent us this email, you're going to get the benefit that you need and you'll be cured, God willing. Welcome to our program, Dr. Otto Gonzalez, the consultant in pediatric dentistry. Welcome to Black and White.
Thank you.
And our dental health actually is something that have a big impact upon how we operate during the day, because because it's not only affect other body organs, as mentioned in the report. Sometimes she has a pain in other parts of her body, but because if you're having especially a toothache, you will not perform properly.
That's right. That's right.
Is that why you choose to be a dentist?
Well, it is well known that once we have a pain in our body, it would affect our performance in
especially toothache is really difficult.
The problem is that we have to solve the problem coming from a tooth is difficult. Mm-hmm. It cannot be done just right away. It has to be done in the dental office. Mm-hmm. Taking painkillers and trying to sedate the pain.
For toothache doesn't work.
It doesn't work. Or it would work just for a short period of time, but the problem is still there. So the best way to go with this is trying to prevent the problem. Mm-hmm. And so it is important to take our children to the dentist at an early age.
Mm-hmm. And this is my first question, actually. What age should the child visit the dentist for the first time?
It should be at around 2.5 years of age. Yes.
When the teeth are complete?
The teeth usually are complete by age 3, but a 2.5-year-old child is adventurous, is active, is not afraid of anything, and usually they don't have a problem at this age. So the first appointment the child would come, we just show the child around, see the dentist, see the instruments, and play around with them. And the second visit, which could be 4 months later, then we start cleaning the teeth and showing the patient what we do and how to take care of the teeth. It is very important to have this early visit, because as the child visits the dentist, is going to get more familiar with the dental environment, and then if ever there is a problem, a tooth pain, a toothache, or tooth decay, the child will not be afraid to be in that environment. It will be just going just like having a haircut, or just.
But once it hurts, they are going to be afraid.
If it hurts the tooth, you mean?
Yes. Usually not only tooth, but the tools of a dentist hurt.
No, man. No.
I've been there for a long time. I know.
No. I think that dentistry it has taken another way. Before, that's the stereotype that we used to be, or used to have, that they're saying that going to the dentist is going to be painful. When my patients come to the clinic, I promise them two things. First, always to tell them the truth, to do exactly as I said, never hide, never lie. Yeah. Always tell them the truth. And the second thing is never pain. And there is never pain, never.
Because you provide them with general anesthesia, or what?
No. We are in the 21st century. We have all the aid that we can use, and we need to provide a painless treatment. We have topical anesthesia, we have local anesthesias, we have sedatives, drugs, we have everything. The patient should never feel pain, and that's what I promise to my patient.
Well, great, actually, doctor, because the last time I visited a dentist was like 7 or 8 years ago, and it really hurt, and from that time I'm taking a good care of my teeth so that I don't go there back again. Right. And thanks God I didn't. What are the most common cause of decay for children and for adults as well?
Yes, well, the real reason for decay is bad oral hygiene. That is the real reason. If we brush our teeth, it will be very unlikely that we have decay. Of course, the in between the teeth is difficult to brush.
Floss will help.
Yes, but flossing is not done properly until children are 11 years of age. So here are the questions. What is really causing the decay?
Yeah.
If we have children, small children, using the bottle as taking the milk and going to bed, this will be decay, for sure.
Really?
If we have children that are snacking a lot, several times during the day, without brushing, they will have decay. If the children have high consumption of sweets, for sure they will have decay. And if there is no brushing, for sure there will be decay. So it is important an early visit to the dentist so that the dentist can provide the parents with all this information.
True.
You know, if we can tell the parents all these little details, which doesn't take long to explain to the parents, so a lot of problems can be prevented by just spreading the word and instruct the parents how to take care of the children's teeth.
True, doctor. You mentioned something that is really important: having a bottle of milk and sleeping. And most of the babies, they have this habit, especially under 2 years old. They take their bottle and they sleep with it.
Right.
This is going to decay their teeth if they have a minimum number of teeth, like maximum 8 teeth in their mouth.
Right.
This is going to result in
Yes.
decay as well.
Yes. So here,
how can we brush their teeth? I mean, for
Right.
less than a 2-year-old baby,
Right.
you can't tell them how to brush it. You can tell them to bring back the toothpaste or something.
no. What we do is actually this is our job as
Yeah.
parents. We all have children, and usually the dentists, all of us have gone through that experience of having children, and we have the children at home, and then we have to teach them. I think that the children learn by watch, by
course.
imitate. So they see the parents brushing their teeth, they brush their teeth. Now, when the time comes to do a proper brushing,
Yeah.
we as parents should do it. I don't think that the children, and it's not just my opinion, children don't have the skill to brush properly and to use dental floss until they are 11 years of age. So we can tell a child, use the dental floss, doesn't know how to do it.
We should do it by
We should do
ourselves.
it. We
We
should
should
do it.
go and brush our children's teeth.
Exactly. That's the way.
Before 11 years old, we should do that on our own.
Exactly.
Wow.
So the question is how we learn all of this. How do we learn how to brush the teeth for our children?
Yes.
It's the dentist that is going to tell you how to do it. It's the dentist that is going to show you exactly what is the procedure to do.
Can you show us now how to brush the teeth of a little child, like in a circular movement or from upwards, downwards, or how?
I think that is before going into that, I think that is the way how you position the child.
Yeah.
Because if you are going to brush the child's teeth in the front, the child goes backward, it wouldn't allow you to do it.
Yeah, true.
So if you position the child in a position that you can hold the child, hold the jaw, and do it in a proper way, and talking to him and very gently, and so you are close to him. The child is feeling you. He knows that you are doing it with love, with care, and everything. But when it's just like, you have to brush your teeth, you have to do it, and it's by force, the child goes like this, and we never do a good job. So when the child comes to the clinic at age 2.5, we inform the parents about it. Now,
sorry for cutting you here, but before 2 years old, before they can understand to bring back the toothpaste, because this is the big fear for all moms, actually, brushing the teeth of their children.
And the child will swallow it.
They will swallow the toothpaste.
Yes.
So how to tell them, how to teach them that, and what is the appropriate age to start brushing our children's teeth?
Well, the question would be, when do we start brushing the teeth?
Okay.
And the answer would be when we have teeth.
When we have teeth.
So the teeth come